All right.
Sure, man.
Welcome back to another episode of Convos on Campus, the show where we dive into research, lifestyle, and philosophy right here in KAUST.
Sweet.
I'm your host, Tayyib, and today we have a special guest joining us. We'll explore their work, their journey, their perspective on life, but rather than me telling all about them, let's hear it straight from the source. Welcome to the show. Why don't you introduce yourself, Dr. Pips?
Hello. Thank you for having me.
Yeah.
It's good to have this podcast. I think it's really nice to have discussions, especially for matters that are scientific, important, philosophical, or anything related to that. I'm a pharmacist. I'm Greek. Got a PhD in structural biology, and currently I'm doing research in drug discovery for cancer, Parkinson's, Alzheimer's, plant biology, anything that has to do with structure of biomolecules, how they work, and all these things.
You said drug biology?
Drug discovery,
Drug discovery.
like early steps of drug discovery.
Like, what is drug like?
Drug like medicine, like
Oh, drug.
drug discovery.
Oh, drug discovery.
Mhm.
Okay, cool. All right. And what inspired you to go into this field of research?
So, from an early age, I really like chemistry, biology, maths, physics. All like I really like problem solving and all these kind of things. Um, when I reached the last class of high school, I had to see what I'm gonna do. I had really good exams. I could enter in whichever school I wanted. So I was between medicine and pharmacy. To my grandmother's sadness, I didn't choose medicine.
Medicine.
Yeah, because medicine is like it's 6 years, and after 6 years, you need other like 4, 5, 6 years to get specialization and do all these kind of things. And I was not feeling at that moment, 18 years old, I was not feeling so much invested in that.
That commitment, that long
It was a long commitment
Long
for
life
something
commitment.
I didn't know about. Like I was 18 years old, 17, medicine. Who knows what at 18?
Yeah,
Who knows what at 25, 30? Like who knows what at the end of the day?
yeah.
So I chose pharmacy because I knew more chemistry than in biology, more biology than a chemist, and I liked this umbrella thing. So I entered pharmacy. I didn't like the courses that much. I was not attending that
During
much.
undergrad?
Yes, during undergrad I didn't like that much. It was a little bit boring. Like going there, like most of the professors. They were professors were really good, and I was going to the lectures. But in general, I was finding it a little bit boring. So I was studying on my like by myself
Okay.
back home, and I saw that studying was really. I was really good at studying. I was really good in reading something, extrapolating what it's saying, implementing it, all these things.
You discovered that at what age?
And when I was doing my undergrad, like if 18, 19,
18, 19.
20, 21, so I'm good at studying. I was not bored by studying. I was really like studying, like this, like getting knowledge. I was really hooked up with that.
Nice.
And when I was finishing pharmacy, I was like, okay, what can I do? I can work in pharmacy, which is okay, but for the rest of my life, I'm gonna just giving drugs to people, prescriptions and all these things. It was not my thing. And I was trying to think like what I'm good at. I'm studying. I'm really good at studying. If I can get paid to study, well, I'm down with that. So I got a PhD, started my PhD in structural biology and so on, and then got into that. And
Right now you're a postdoc, right?
I'm a postdoc right now.
Yeah. And you did your master's where?
So pharmacy is 5-year curriculum. So it's same level. It's diploma of pharmacy. It's same level as masters. So
Okay.
after my undergrad, which was master's level, I went straight up for PhD in Italy.
And okay, so you did your pharmacy studies in Italy.
I did my pharmacy studies in Greece.
In Greece.
And after I finished, I got my PhD in Florence, Italy,
Okay.
where I lived like 3-4 years.
Okay, and then you came here for postdoc.
Well, and then I had 1 year in which I was trying to see what I want to do. I was a little bit bored with research. So at some point, I was thinking, so when you're doing research, you go to the lab every day.
Just like you were just before this.
Exactly. And every day you go and you have something new. You don't know what you're going to do. You're going to use something new software, new technique, new methodology.
Mm-hmm.
So I was starting getting bored of all that. Like, oh my God, I'm gonna be doing that all the time. I want to work 9 to 5. So that year, after I finished my PhD and I did some other stuff, I started working in a pharmacy. I loved it for 3 months. After 3 months, I knew everything. There was nothing new to learn. So I was starting freaking out, like, what, I cannot do that for the rest of my life. And I get
You
back
hit a
into,
plateau.
I hit a plateau in which I knew
Mm.
everything in the pharmacy. I knew there was nothing more to know, to gain knowledge,
Mm.
and I started freaking out. Like, I gotta get back to research, like, mandatory. And I found a postdoc here and I came.
Oh, nice. Okay.
Hmm.
And you're working with which professor?
I'm working with Professor Łukasz Zaremko. He's
Okay.
from Poland.
Ah, okay, he's Polish.
Hmm. He's doing
Okay.
protein MR, but we also use other techniques, cryo-EM, uh, crystallization of proteins,
Mm-hmm.
doing a lot. We have a lot of collaborations.
I guess you utilize the core labs a lot, right?
Yeah, a lot, a lot. Core
Mm.
lab, like having core labs in university, it's just perfect.
Okay. Well, speaking about core labs, you might have maybe discovered this, but what is the most surprising discovery, unexpected discovery that you found out about your work?
Um, while while pursuing knowledge from undergrad, master's, PhD, postdoc,
Hmm.
um,
You've done the whole trail.
yeah, I've done the
Hmm.
whole trail. You realize to your uh, not I wouldn't be saying amusement that the more knowledge you gain, the more you realize that you don't know anything. The more knowledge you gain, the more you realize that this whole bubble of knowledge is bigger than you expected.
Hmm.
And you realize that the more you knowledge you get, the less you realize that you know compared to the whole.
Hmm.
So you get the understanding, and you have this apocalypse into your mind that I can never know everything.
It's a paradox.
It's a paradox, yes. So you learn more, and the more you realize that you don't know anything at the end of the day.
Okay. So like you would sum it up as the is that doesn't matter how much I learn, I end up not knowing anything.
Yes, at the end of the day, that's what it is.
Mm.
When I see it, I see it.
You see it when you see.
I see it here in KAUST. You have a beautiful, um, luxurious scientific village with
Hmm.
a lot of scientists. So whenever you go to a house and you have a gathering, you meet people from other kind of scientific
Discipline.
disciplines, and just by talking with them, you realize
How
how
specific you are.
sophisticated and so specific they are. They're like, man, there's so many things. The
Mm.
knowledge is just huge. We cannot comprehend how huge it is.
Hmm. Okay. No, but I was referring to an unexpected an unexpected thing within your domain. Like what's one thing that surprised you about pharmacy, or that surprised you about doing all your work?
Like during my undergrad, when I was studying pharmacology,
Hmm.
I was reading how drugs are
Synthesizing.
no how they're operating biologically speaking, like
Mm.
physiologically speaking, and in in the drugs related to mood, to all the drugs that are being administered by psychologists and psychiatrists,
Hmm.
the psychiatric drugs. Uh, Most of them, it was written, there is no known, um, uh, it is not known how they interact and how they act.
It was not known.
It is not known. We don't
Mm.
know exactly how they act. We know the result of it, but we don't know exactly in which biological pathway exactly what they do and how they operate.
Really?
Mm-hmm.
Like the mechanism.
Exactly, that was the word I was searching for. So the
Mm.
mechanism, it's not either fully understood or not even known at all.
It's not well defined, and it's not even defined at all.
Mm-hmm. For
Okay.
psychological drugs,
Wow.
which is, I mean, it makes sense. The brain is just,
The human body is just a huge mystery.
it is a miracle. And on top of everything's consciousness.
Mm.
Like human being have like reached a point in which you have we have a conscientious brain that we can think time. We can we can in our mind we can take ourselves and project ourselves into the future and see what the outcome will be. Like just think of it just a little bit, just to realize, okay, if I do that, then I do this, and then I do the other thing. Animals don't do that. There's a huge gap between animals and humans. That's like humans are super distinct from animals.
Of
And that
course.
bugs me.
Mm, yeah, we are very sophisticated. We developed so many technologies. Not even this modern society or modern civilization, even way back, like the Egyptians and the Mayans, all these different civilizations that lived before.
It
It's
is
crazy.
like there's a lot of technology that can easily have been lost during human history.
Yeah.
Like Elon Musk was saying, like we have to keep going at the moon. But the last time when the moon was when like 1960s, 70s, I don't know, somewhere around there. We haven't been there. Like if we stop doing it, then we'll forget how to do it, and that's how it is. Like how did the pyramids end up? Like why is it lost? Because we people forgot about it. There should be
Mm.
a way that they made it.
Hmm.
I hope.
Yeah. Yeah, it's crazy how. But right now we live in an age where data is being stored, and so we don't know how things are gonna progress. We live in a digital world, and
Yeah, at least now we have the means of mm, keeping keeping data and portfolios of what we're doing,
hmm
so we can write down what's up, at least.
right,
Back in the days, it was not easy to write, and you could not save all the all the
all
technologies
the
and
work.
all. And yet, I strongly believe that there's been technological um, artifacts and technological things that have been lost because we never used them, or we never nobody ever wrote them down.
hmm Yeah, a lot of information has been lost in history.
Hmm.
Um, a lot of sciences lost due to war or vandalization.
Science also progressed due to war.
Mm,
Like war was a force
impact.
of impact to science. Sometimes in a good way,
Mm,
let's say promoting scientific growth, and sometimes as a bad way, like the accelerating the the promotion of the
of
growth
science.
of science. Yes.
Yeah. Okay. So, what's one habit you think every student should develop?
I believe that writing is the most important thing that a student should do.
Hmm
Writing, because writing is one of the best ways of increasing your critical thinking. And why I say that? Because in your when you write, what you have to do, you have to keep in track of your thoughts, see how many words there are in there, and put them in order. So that thing that you put in order makes sense.
hmm
This whole process is a process of critical thinking.
Right.
And critical thinking is one of the main things that a student needs to have. Every person, like especially a student, like a scholar who wants to study and learn the sciences or philosophy or whatever, they have to get that. And a lot of students don't get it because, oh, I have another essay to write. Oh, I have another thing to write. They don't like writing. People don't like writing because it's difficult. But that's the reason we have essays. Like you have to sit down and write. You have to sit down and put your thoughts in order and see what's going on. Try to make sense out of it.
hmm
That's how you maximize your critical thinking.
Okay. Yeah. Writing is where you um, basically crystallize your ideas
Exactly.
and filter them and put them in a way where other people can digest it
Hmm.
and absorb the information in the right way.
Hmm. Like you may be an incredible mind and really smart, but if you cannot put it down and write it down, it will be lost when you'll die.
Yeah, if you cannot communicate it,
Exactly.
no one is going to read your brain.
Hmm.
Yeah, and sometimes there are ideas that are very hard to describe to in words, right? Well,
That's the thing. You can see like big minds and geniuses of our times and past times, they have this particular ability of expressing really complicated ideas in a really simple way.
Mm-hmm. Yeah, it's always the experts that can make it simple, right?
That's that's why they say you have to learn all the law. You have to learn all the rules so you can break them as a like a pro.
Uh-huh, right.
So they know everything. So they know all the complicated theory behind something, so they can express in a simplistic way that a person can understand it.
Right, they understand the whole picture,
Mm-hmm.
yet even with their vast knowledge, they still do not know too much, right? Like, that's how it
Sadly,
becomes crazy.
sadly.
Mm, yeah, yeah. Writing is so you'd say writing
Hmm?
is so you'd say writing is number one.
I believe writing is number one. Yes, this is like it's a must-have. You have to know, and the more you write, the more you become better at it.
And like, do you do it on a daily basis? Like, do you write journals or do you,
Like
or
you
just?
either write journals, so it doesn't matter what you write.
No, I'm talking about you. Like, look, what
That's
do
what
you?
I'm saying because it's not that every day I'm writing a journal.
Mm,
I would love to, but I don't.
mm-hmm,
So I may write songs, or I may write text, or I may write lyrics. You like you have to like the more you write, the better you become at it, and the more you increase your critical thinking.
that's great. Yeah, that's a great piece of advice.
So like every day I write something, anything, just 2 lines on whatever. It can be from science to poetry to philosophy to I don't know, um, a reply to a comment when you have an argument on dinner, for
Mm,
example. Anything like just keep try to put your thoughts in order into something that makes sense and it's understandable.
yeah, that's great. That's a great advice.
Hmm.
And I think there's also value in writing with your hands. I think we lost that now with everything's digital.
I mean,
But there's a connection that happens when you write formulas or when you write. I mean, it's still it's a fine line, but
I don't have the knowledge about this particular like the difference between writing by hand or
mm,
writing by computer. What complications could have or what effect could have in someone's learning ability. I don't know about that.
mm,
Um, I presume that writing by hand is more complex. It's more complex act.
mm,
So you have to coordinate your hand, your like everything, rather than just typing. So in that sense, when something's more complicated, most of the times will give you more.
mm-hmm.
So I would be saying writing by hand, but then I don't write by hand all the
Yeah, I mean, I
time.
would say, but I wouldn't do it as well most of the time. I mean, except for when I'm writing meeting minutes, like if I'm writing like notes during a meeting in a small notepad,
Yeah,
then
exactly.
yeah,
Or when you
okay.
want to do some quick equation or whatever.
Mm-hmm.
But sometimes when I'm really my want to take notes, if I leave 2 days to pass, I cannot understand anything or whatever. Like I'm like my
The memory is disconnected.
it's not a memory. It's like my how to call it?
The scribbles
My scribble is just like horrible.
is horrible.
Yeah,
That's a classic pharmacist. We
yeah,
have a
it's
joke
horrible.
that like we don't know how a doctor or we don't understand how a pharmacist read the notes of the doctor.
Yeah, did you know
There's
too?
like a
So
code.
when I go to a pharmacy to start working on it, I starting like you should know all the letters, like all the names of the drugs, all the market letters of the drugs, and then you just try to understand.
Decipher.
Then you start asking the patient, mm, so why is he giving you this? So you can try to understand what could be.
Yeah, yeah.
I remember once we were four pharmacists in the pharmacy.
Mm-hmm.
So it was the leading pharmacy, senior pharmacist, and two more pharmacists. And a prescription came, and we're just looking on. I took it. I was looking at it. I was like, yeah, I can understand what is that. So I give it to the other pharmacist. He was looking at it. Like I can understand. He gives it to the senior pharmacist. Then we
Mm.
call the lead pharmacist. We put it there, and we're four people on top of and we're trying to understand what he could be saying. We could not understand. We just called him and we asked what it was.
Wow. Yeah. I don't know why doctors do that, make your life miserable, but
We don't do it intentionally.
no, I
We
know,
just
but like, it's like,
yeah
come on, put some effort into just the word, just the keyword,
yeah.
Yeah. Okay. Uh, how do you balance life, personal life, research, and hobbies?
Hmm. It, I I try to think it as an equilibrium. So if you only work, you will end up not being good at your work. If you only do hobbies and you don't do anything else, not work, then you end up not being good at your work. So you have to find a sweet spot in which, in general, for most people, like from 8 hours a day working,
Mm-hmm.
most people are productive at 6 hours. 6 hours are productive. After 6 hours, your productivity goes down
Mm-hmm.
to around 80%. After 8 hours, you start being counterproductive. So that means you're producing, but mm, the amount of of
Energy.
the amount of energy that you're spending to produce a percentage is it's not that big as if you were working into your regular hours.
It's not worth it.
No, that's why like big companies they don't want to pay for extra hours.
Mm-hmm.
Or like you're done, go leave, don't work because you start like why should I pay you hourly working when you're not productive, as productive as you should have been if you
Mm-hmm.
were working regularly.
Right.
So though this in the life of a scientist is not absolute because you sometimes you may work 10 hours, 12 hours. You may pass by the lab during the weekend to do something fast or whatever. So you have to restrict yourself and also push yourself whenever you need to.
Mm-hmm.
So in general, I just try to do all my stuff in the 8 hours that I have
In
in a
terms of
day.
work,
Yes. And when I leave work, I try not to think about work. It's not easy.
it's not
Like you
easy.
really have to restrict. You really have to push yourself.
You have to actively monitor what
You have to
thoughts are going.
monitor yourself. Like stop it.
Mm.
Unless it's like there you have a deadline or there is a I don't know, an alarm situation in which you really have to take care of something. If you're working with living cells and you have to pass by, I understand that. But in general, you must give time to yourself to breathe, to do something else. You must do it. And if you don't do it, you will see productivity will go down. You will burn yourself.
The equilibrium is going to be ruined, and then you're going to end up ruining yourself, and
Yeah, you will not be able to be productive at all.
the output is not going to be good. You're not going to
No,
be
it's
in a
not.
good mood.
Mm. They will
It's
not. You'll make more mistakes. You will not be there. Cannot be concentrated. You cannot be concentrated that long.
mm-hmm.
Like the average person cannot be concentrated for so long. So you have to put yourself. Now I stop.
Right.
And also you also should do the opposite. You should not just going outside partying and I don't know playing and swimming and having fun and just do that and not giving effort in that. So you
Mm-hmm.
have to find this sweet spot. And for me, at least, it's like 8 hours a day should be enough. I remember at some point when I was doing my PhD, I had my PI was an old school, really good, really smart woman.
Mm-hmm.
Um, she was the director of the center I was doing my PhD at, and she was old school. She was like, you have to work till 9 p.m. from
9
9 to
p.m.
9, like every day. So there were a lot of people that were staying, let's say, they were finishing work at 6 or 5, and were staying more just to be seen that they're there.
Mm.
So I could not do that. So I was finishing around 6, and when I was finishing, I was leaving. I remember once I heard her. She was the next door. So I finished around 6. I
Mm.
knocked the door. I was like, bye bye, and she went mad. So God, what are you doing? You're not working. You don't work weekends. You come at 10, you leave at 6, only 8 hours. What do you think? You're gonna take your PhD because you're smart?
Mm.
And then I just told her that, listen, professor. I try to commit 8 hours a day, 5 days a week for what I'm doing.
Mm-hmm.
Sometimes a little bit more, sometimes a little bit less, depending on what I have to do. If this is not enough, then it's not. I'm not for a PhD. Like if this time that I'm supposed to allocate for my PhD is not enough for me to do it, then it's like I'm gonna do something else, and that's fine. Not like it's not everybody who can go and finish a PhD. It's not everybody who can do all kinds of jobs.
Mm-hmm.
Not everybody can be a driver. Not everybody can do all sorts of different labors that we have as humans. I'll find something that suits me. I think that's
Okay.
how it should be.
And what happened? Like,
It's
were you
only
the most productive one in the lab, even though?
I don't I don't I was not comparing
Mm.
myself to somebody else. I was
Okay.
just trying to finish off what I was doing.
Okay.
Like comparing yourself to others makes helps nobody.
No, I know. I'm just saying that because the others stayed and did all that work, but okay.
Yeah, I published like 3 or 4 papers. One was in Journal of American Chemical Society, like JAX, was a really good impact factor,
Mm.
really good. Uh, so it went really well.
Nice.
I had no issue with that.
Okay. That's
And I
great.
remember when I was doing my PhD, when I was leading the lab, I was not doing anything connected, anything. Now, where I am, the lab is pretty close.
Mm.
In 5 minutes, I can be there. So I'll pass by, I may leave a little bit later. So I get into the trap of not being able to restrict myself.
Okay. So what's the best and because we're speaking about the lab, what's the best and what's the worst part about the lab?
The worst part,
The best and the worst.
the best and the worst. The best is the fact that you can schedule your time to your
Mm-hmm.
own needs.
Mm-hmm.
That means that you have 8 hours, let's say, a day. If you're good at it and what you're doing, you're really good at it, then you can finish like in 4 hours, for example. And then, I don't know, go do something else or work on a side project.
If you're efficient in one
If
way.
you're efficient, if you're good at it, or you're lucky sometimes or whatever. Um, now, so you can schedule your time.
Mm-hmm.
You can work more, you can work less, like depending. This you cannot do it in a 9 to 5 job. In a 9 to 5 job, you're there 8 hours.
You're stuck.
Doesn't matter.
Yeah.
You're there. So you have the flexibility.
Mm-hmm.
Um, that's a good, yeah, that's a good thing. The bad thing is bad. Yeah, the bad thing is that you have a lot of um, what is the opposite of success?
Failure.
You have a lot of failures,
Mm.
and
Frustration.
you have a lot of failures and frustration because when you're doing experiments, you will get a lot of failures, and if you cannot keep yourself motivated and positive and to continue pursuing what you're doing,
Mm-hmm.
then may you be end up in a bad place.
In the low place.
Yeah, like mentally speaking. Like there was a publication that was talking about the mental disorders of PhD candidates
Mm-hmm.
in Europe, and it was found that 50% of PhD students, at some point during their PhD, they're considering of abandoning it, and around 20 to 30% end up with some minor psychological or mental issue when they finish the PhD. So,
Mm-hmm.
like doing PhD, it's tough, it's hard, it takes a lot from you. It's part of you. So
But you are not the PhD. Like, it's part of your life.
it's part of your.
Yeah.
It's part of your life.
So you have
That's why
to.
you change.
That's why you balance.
That's why first you have to balance it. But it's so important. That's why you put doctor in front of your face, in front of your name.
Mm-hmm.
Like it's part of you.
Yeah, that is correct. Okay. So, if you had, if you were to have lunch with any historical figure,
Mm.
who would it be and why?
Okay. First thing I don't in general don't take lunch. I eat once a day after
Okay.
the lab. So yeah. But if I had the opportunity to do that, probably, I mean, probably Jesus.
Mm-hmm.
I mean,
Okay.
he's he's one of the most talked personalities in the history of humankind. So I would like to meet him, in
Mm-hmm.
person, to sit down and see like what is all about. A part of the, like both the Quran and the Bible, they portray him as the Word of God. So like there's a lot of wisdom there. So we'll try to take something from there.
Mm.
So yeah, I think it will be really fascinating uh, experience and opportunity to sit down and have lunch with Jesus. Yeah, I will doing that.
Okay.
Like who else? I don't know.
Yeah, I mean, let's go back to year zero.
Yeah, I don't know. Yep, man, I don't know. It's better if he will be coming in 2025.
You wanna bring him here?
It's probably better.
Have a discussion here with him in the library.
Would love that.
Mm, that's cool. Okay. Uh, what is what is a big misconception about your research that that the general public has and you would like to clarify?
Yeah. For example, I'm working in drug discovery.
Okay.
It's a really long, time-consuming process. People hear drug discovery, the first thing they think like, what kind of drugs have you working? What kind of drugs? Like, it's not that you're working and every month you find a new drug
Mm-hmm.
for a new therapy. Um, you're working and you're doing really small steps,
Like incremental.
like really small incremental steps in which other people will use your knowledge
Mm-hmm.
and your studies to make other small steps, and their studies will be used from other scientists that make more steps, and all this
Contributions.
contribution step by step by step. At some point, it would lead to a new drug. So when I say I work in drug discovery, people, have this misconception like, oh, every month you should be,
Making a new drug.
yes, exactly, having a new drug. Like it's not like that.
Mm. You improve maybe like a part of the mechanism or a reaction or something
You
or
understand how the mechanism works.
mm,
You understand what is the structure of the biomolecule that you're interested in.
mm-hmm.
Because after understanding the structure, then you may be able to start designing something that will go and stick on that,
Mm-hmm.
so it will change
Right.
its biological activity.
Hydrophobic,
And
hydrophilic, and
electrostatic,
so
anything.
stuff.
So there are so many variables and so many things to study and check. And then you find something that sticks there, does that, but doesn't stick that very well. So you have to change it and find something else, or change it a little bit so it can stick more. Then it sticks too much. Oh, you have find something else that makes it stick a little bit less, but not too less because it's not going to work.
Mm,
And then you get into clinical trial. Like it's a huge process. So it takes a lot of time.
mm. Drug discovery. Yeah, drug discovery is not that, oh, I made this drug.
Mm?
Time for the next one.
Yeah,
Next one.
it's not like that. Like there are drugs that are in the market and people still studying them for other um, diseases.
Mm-hmm. Okay, cool. Right. What's a simple experiment or a simple fact that everyone should know about your field?
Just because something is chemical, it doesn't mean it's bad. And just because something is natural, it doesn't mean it's good.
Mm-hmm.
So there's this marketing uh, tool that is being used
Natural,
all the time.
organic.
It's natural, it's organic. So that's just because it's natural doesn't mean it's good for you.
Mm-hmm.
And like you can find poison in nature that will kill you instantly.
Mm-hmm.
It's natural, but you shouldn't take
You shouldn't.
it. And just because something is chemical doesn't mean it's bad. Oh, chemical, that's chemical. It's been
It's made in the lab.
synthesized. Like, yeah, it's chemical, but it can help you. You take vitamin C, 1,000 milligram a day. It will boost your immune system
Will push
way
you.
more than just drinking a little bit of orange juice, and that's a fact.
Or cracking open three oranges and like
Yes, no, like 1,000 milligram of vitamin C. It's not in 3 oranges. You need like a lot of
You-
oranges to reach
It's like a
1,000
bucket.
milligrams. It's not that you're going to absorb all 1,000, but you get 1,000, so you will absorb as much as possible.
Mm,
So yeah, just because something is chemical doesn't mean it's bad, and just because something is natural doesn't mean
it's
it's
good.
good.
Mm, okay. So yeah, I guess that's a big misconception. Like people get afraid of stuff made in the lab and like, oh, it's not natural.
Yes, I'm also skeptical when I hear that something is synthesized. I want to know what it is.
Yeah, you should
But
do your own exercise, right?
yes, but the thing is, I have the means and the knowledge where to check and what to check, so I can know what we're talking about and what is this.
Mm-hmm.
The average person will Google something, and the average person will Google their symptoms, and they will end up thinking they have cancer. You know what I'm saying? So that's why you need the doctor to go and see, show him
Results and
your symptoms and everything to make a diagnosis. We cannot make diagnosis by ourselves, and we cannot know what is um, if something chemical is good or bad. Like you have to search for it a little bit, and if you don't know how to search, you should ask somebody who knows how to search. That's why we have professionals in this.
right. Yes.
Like sometimes I have arguments with my mom, just telling me some things about, I don't know, oh, this is chemical, oh, this is, oh, we shouldn't eat it, we shouldn't, I don't know. Like mom, listen, I'm a pharmacist. I'm your son. I'm PhD in structural biology. I'm working in drug discovery. It's fine. You can take it. It's okay. It will not make you, like if you take a vitamin, it's not gonna make you feel bad or whatever.
And sometimes the placebo effect. So like even if you're taking something that's very beneficial for you, but you're still afraid of it might backfire,
Yes,
right?
good
Like isn't
backfire.
it true that some people like you give them a placebo experiment and then they think they're taking medicine, but they're not taking anything, but they end up healing?
Mm-hmm.
You know that
Yeah, yeah,
that
I
crazy
know.
thing?
Yeah, yeah, that's it's not crazy. It's because our body is all the good, all the hormones and all the signals to express all the proteins and everything we need. It's coming from the brain. So if you have a good mood and you're feeling good about something, then that will have a good effect on your body.
In your body, right?
If you don't feel good about something and you're anxious about it, it will
It will show.
it will also like make you feel, it will show on your body. Like classic characteristic is that there are people that, for example, they had cancer for maybe several years, they were
Mm-hmm.
not diagnosed. They get a diagnosis, and after a year or some months, they just pass away
Okay.
because they learn that they have cancer,
Because they
and
know,
this
yeah.
completely destroys um, their
Mentality.
psychology and all this bad energy, let's say, all this anxiety, because anxiety is is making it's actually destroying your body. It's destroying all the chemicals in your brain, and it's going all around your body. So that's why you have to have a health brain and a health body.
Right. Just as we said it before in the previous one, it's like healthy body, healthy mind,
Exactly.
and the other way around.
Ancient Greeks were saying that. Arabic culture was also saying that.
Mhm.
Also in
It's
Iraq,
common.
it's common. It's something that
People
people
have
know.
learned.
People know, no matter the culture, no matter what.
Yeah.
In Greece, for example, there is this saying that says, "Oh my God, mm, you made me get cancer for making me so anxious." Like mothers or
Ah,
parents say that.
you stressed me out to
You
the point of
stress me
cancer.
so much I have cancer. But
Yeah.
and after so many years, we see that there is a correlation between stress and cancer.
Mm-hmm.
People didn't know about any correlation between stress and cancer.
But existed.
It just came out as a wisdom from cultural from living, from interacting with each other.
Right.
So, and these cases are all like you can trace these cases all around.
There's a factor always.
Mm-hmm.
Stress is always a factor sometimes.
Yeah, stress is it's a bad
Mm,
it's a bad habit.
okay. Yeah. I mean, we live in a, I think, I'm not sure if we would like to label ourselves as special, but I think we do live in a very competitive time, right? We do live in a very stressful time.
Mm-hmm.
You have to work and you have to provide and you have to be productive a lot. But not sure what's your take on that. But,
Yes, but people also need to be productive and work back in the days.
but it's how you do it, right? It's, it's not like it's how you become productive. You have to basically be efficient and know how to capitalize on your strengths and manage your time and always try to minimize that stress, right?
Mm, I'm not a very good example about stress because I'm not getting stressed easily.
Mm,
I'm not getting like I can get stressed. I don't get anxiety.
mm,
Like I never remember myself having anxiety. I can be in a stressy situation in which like I'm in an alarm and I have to see what I'm gonna do. But apart of that, I'm not.
overall.
Yes, because okay, let's say you have an issue in your life, in
Mm,
your work, in whatever. There are two possibilities. One possibility, you can do something about it. If you can do something about it, why do you need to be stressed? You can do something about it.
there's a solution, yeah.
There's a solution. So
Mm-hmm.
there you go. You can work your way there. Now, and the other possibility is that you cannot do something about it. You
Then see,
cannot do something about it. Why be stressed? You can't do something about it anyways.
mm-hmm.
So you have to trick yourself into seeing, taking everything. Of course, this is too rational, but at least you have to start from somewhere. Sit down and see, can I do something about it? Yes. Can I do something about it? No. Like that's how I perceive things. I try at least.
Yeah, that's I don't think most people have like or uh, not all people think that way, right? Some people cannot get into a state of stress and they cannot, figure their way out. But
Hmm.
you should always try to minimize that by taking your mind off things and uh, trying a different approach, right?
And also, every person is different.
Mm-hmm.
Like whatever you do for minimizing your stress may work on you, but
May not work for
may
you.
not work for me at all. Maybe make things worse.
Yeah. For you, maybe as well, is that when you play basketball, it does, it does something to your body, right?
Hmm.
It releases a lot of, hormones. It,
Of course,
yeah.
toxins, and it's under stress. Like in general, working out is under stress.
Mm-hmm.
Is under stressful. It's good. It's good for your body, and also working out is the most major factor that affects IQ decline.
Mm-hmm.
So, like your IQ is the IQ of the human being is peaking around 21, 22, 23, and after that it starts declining a little bit. The factor that actually decreases this decline of the IQ is not math, it's not chess, it's not literature. It's working
Mm.
out.
It's just classic hit the gym, lift some weights, and
Do something.
get your heart active.
Mm-hmm.
Walk.
Yeah. You have to do
Walking.
that.
Yeah. Okay. What is the most controversial opinion that you stand by no matter what?
Most controversial opinion, huh?
Controversial opinion.
Mm, let me think of an
Mm.
opinion that's controversial. Uh, let me think about it a little bit.
Okay, we'll get back to that
Get
one.
back to that. Let me process it a
Yeah,
little bit.
no problem.
Mm-hmm.
All right. Uh, what is a fact about you that sounds like a lie, but it's 100% true?
Mm, I try not. Okay, I can respond to both of them.
Hmm. Let's
Okay,
go.
so controversial one is that I strongly believe that lying is stupid. A lot of people may think like, no, sometimes you have to lie, sometimes you like. I believe that the best outcome is when you say the truth. If you lie, you you will end up in a bad situation. Aristotle was saying that any distance from the truth at the progress of the time gets magnified. So if you say even a small lie,
It's gonna amplify.
As time goes by, it gets magnified. So it will be shown. And also, if you don't lie, you don't need to remember anything. Like if
Your
you lie, you have
resources,
to remember things.
your resources are more allocated to other things.
Yeah, like it's a waste of time. It's a waste of time. I mean, it's the best outcome that can happen is to say the truth.
Right.
Though there are people who say that just because it's truth, it doesn't mean that you have to say it. I understand that because some people don't. Not a lot of people like truth. Not a lot of people like.
Can handle.
They may say that they want truth, but they cannot handle. So yes, so that my most controversial, let's say, thing is that lying is stupid. And the other question was,
what's an unpopular opinion or most controversial opinion?
Yeah, like lying is stupid. And the next question was
that it's the most controversial opinion that you stand by no matter what.
Yes.
And what's a fact about you that sounds like a lie, but it's 100% true?
Like I try, like I will not. I always say the truth. It may sound like, yeah, everybody lies. Like I understand that everybody lies in one way or the other, but I don't know.
For you, it's like
I don't lie. I don't find the reason. Worst case scenario, I will just not say anything. But I think it's stupid to lie.
You would never lie.
I don't like being absolute. Saying never. But I may find myself in some situation in which lying will be beneficial at that moment. I don't know what kind of situation that could be, but I understand that lying could have an approach that could be useful in some cases. But that's not that's an excuse that people use to lie all the time.
Right. like oh, it's just a white lie.
Yeah, exactly. So like, just because they're a white lie doesn't mean you can lie all the time. And just because let's say you're if you kill somebody, it's bad. It's not good.
It's absolute bad.
It's absolute bad. But if you're in a car and you're going and it's green and somebody just passes through and you don't like you're going and you hit him and you kill him, yeah, it's bad, but it's not like your fault.
Yeah.
You know, just because in that case you don't go to jail, just because there is this this exclusion in which killing is not bad on a sense that you didn't kill him. Doesn't mean that killing is good.
Right.
Although who go around and kill people. So lying is stupid. There are some cases in which it could be useful, but again, that's not an excuse to lie, because people use it all the time to lie, all the time.
Right. People abuse like.
Of course they do, because it's easy. Lying is easy.
I guess. I think there was a stand-up comedian who was saying that I remember the feeling of discovering lying when I was young, and how it can solve problems very magically.
Exactly. I think also, like, I think most people realize at some point, like, oh, I just can't lie and just stop talking to me.
Yeah.
You know? Hey, who ate that chocolate? Not me. I'm done. If I say me, I have to go there, and I have to get attention, and I have to be, whatever. I understand it, but it will not be good for you.
Okay. Then what's a terrible habit that you would like to change, that you have?
I have a lot of terrible habits.
But if you were to choose one.
I think the most terrible one is that.
What's one that you would like to change, and what's one that you wouldn't want to change?
Okay, I have like two real bad habits. One is junk food.
Junk food.
I like food, and I like eating a lot, like junk food. That's why I try to eat only once a day, so I can eat whatever I want.
But you balance it with working out,
Yes, but I'm working out I start thinking that I'm just working out because I want to eat. Shit.
It's a
Uh,
big motivation.
it's a
Put the
big
KFC bucket
motivation.
in front of you and watch you go.
Exactly. So
Watch yourself
yeah, and
go.
I don't think I'll be changing it unless there is a medical issue. That's
Hmm.
why I'm trying to be healthy. I'm trying to work out a lot. And the other like terrible one is that I stay up late. I really like the night.
It's like you like the quiet times where
Yes, a lot. Like I like the night. I'm a person of the night. That's why I like Saudi Arabia.
you're a night owl, huh?
I'm a super night owl. Super night owl. The past 2 months, I'm really trying to work that. So during working days, I try to sleep around 1,
Hmm.
maximum 2. During weekends, like I don't.
You know what? I
Like I
wouldn't.
go to sleep when I see the sun goes up.
Mm, I've done that a lot.
Yeah.
And let me tell you something. I think my brother had a poster once. He bought it from eBay or something, and it had on the poster one of the not one, but a couple of the world's greatest inventors and thinkers. And on the poster, it had their day or their like their time slot, and it had like time windows where they work and where they sleep, and you could see a lot of smart people like they work in bizarre times. Like some of them work like from 3 a.m. until like 6
Yeah.
is when they have that moment.
Okay, but biologically speaking, it's really bad
It's
for
bad.
you though. It's really bad.
It's bad
Like
because like night is made for sleep.
you have to
Like
you just stabilizing your circadian rhythm. You it's not good for you at all. Like the best thing is to wake up at the same time every day.
routine,
Routine. Put yourself into routine. That's the best thing. Like I know the theory, I'm just not
but
doing
I'm
it.
not applying it.
Yeah, I cannot apply it at the moment. I would like to. I'm the past 2 months I'm really trying on that a
Hmm.
lot. Um, but I really like the night. I don't know. It's just like everything is so.
Peaceful.
I feel it's I feel like this time is mine. It's for me. You go out to walk in the city or whatever. You feel like you own the city.
You own the time and you
You
own.
own the town. You own the city. You have the time to ride. You have the time to do whatever you want. I don't know. Like during rush hour, during the day, you have to do things. You have to
Distractions.
run. You have distractions. Oh, somebody texted me. Somebody called me. During the night, who's gonna text you at 5 or 4?
That's the best thing about the night.
Not a lot of people.
Yeah.
I have some friends who will, but not a lot of people. So it's you have more time for yourself.
Yes. I mean,
But it's really bad.
it's bad for your health,
Mm-hmm. It's really bad for your health.
but you can get away with some nights that.
I mean, I don't know. Like I check that because it's tracking time. The past year, the average hours I'm getting is like 6 hours.
Of sleep or.
Yeah, I know.
Hmm.
That's the average. I
Okay.
mean, and it's not good.
It should be more. It should be.
It must be more. It's not good. But I'm working on it. I will fix. I can fix. I don't know about the junk food, but this I will fix it.
Okay. Once I do this.
Yeah, step by. You cannot solve all problems at the same time.
Yeah.
Go one by one. If you try to solve everything the same like simultaneously, you will not solve anything.
Okay. Well, let's jump into something more fun and something more
Mm-hmm.
more more interesting. What is the what is the worst pickup line that you have ever received?
Ah. um, here once there was a girl that she made a good compliment about my nose.
About your
I
nose?
have a really nice nose.
Mm.
Like, oh, thank
Stranger.
you. Stranger, like you have, like I don't know, or I didn't know her. Like you have a really nice nose. Like, thank you. Did you make a plastic surgery? No. Oh my God, you have such a nice nose. I want to punch you.
Oh wow, that
Yeah.
escalated quickly.
Yeah, that escalated quickly, but it was not a good way. Like, to it was really bad,
She's like a
really
nice
sloppy.
nice nose. I want to punch it.
Yeah, right. Like it was literally like hitting on me. Like she was really trying like to flirt with me, but like that's not the way to do it, girl.
Wow. It's like something is nice. I want to punch it. Wow. Okay. That's I guess very interesting behavior from that person.
I don't know. Maybe she found it cute. Maybe somebody else would be finding cute. I just don't find it cute.
It's not here.
Yeah, it was not. It was. I don't know. It
The,
was not. It did
different
not work, and it felt kind of awkward. Like, okay,
different nose,
it
please.
didn't make me.
Actually, yeah, it's plastic surgery. Please don't touch it.
I don't know. Or the
Yeah,
other time, it was a girl who told me have really nice calves.
you have a really
It was the
nice
most
what?
beautiful calves I've ever seen. Like calves, like this
Oh,
calves.
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 Ah,
But like who says that?
what X-ray vision? What X-ray vision?
No, no, I was wearing like shorts. But like who says that?
Mm,
And even if you said like how do you expect that to be
what's the response?
anyhow like
Like,
how
oh,
am I
watch this.
oh yeah, check that. Like what am I supposed to do about it? Like thank you.
Oh, you
Okay.
like this? Hold on a second. Let me flex.
Right? I don't know.
Oh, that's really funny. Mm, okay. Uh, it's gonna get more personal.
Mm.
So, what's a toxic trait that you have? What is your toxic trait?
Hmm. I have a big mouth. I have a big mouth.
Mm,
If I want to say something, I'll say it.
just say it.
Yeah. And
Mm,
it's like I could have saved me from a lot of,
trouble.
drama and trouble. But I can't. Like if I want to say something to you, I'm gonna say it to you. Like straight up. I cannot keep it inside. And that's bad. It can be toxic.
Yeah.
Because again, not all people want to know the truth.
Yes.
Like I'm the guy who my girlfriend will ask me, do I look fat in that dress? And if she does look fat, I'll tell her, yes, you look fat in that dress. I'm that kind of person. You know? I'm that kind of person.
So, if you ask Dr. Spiro, you're gonna get the truth, no matter what.
The truth. What I believe is true.
Yeah, I mean, from you, of
Yeah, yeah,
course.
yeah. What I believe is true.
Yes.
Yes. That's the thing.
So big mouth.
Yeah.
Yeah, it's a weapon. I mean,
It's a weapon, but it can backfire, like all the weapons.
especially with the ladies.
With everybody, not just the ladies, with everybody.
Mm, yeah.
Yeah. So like for example, I know that a lot of girls, like all from the relationships I had, like they were really liking the fact that I'm really cool, I'm really sincere, and I'm not jealous. Like
Mm,
this thing always. And during the relationships, in some not all of them, but like I've seen like in the relationships, like while these three things were the things that really made them really like me, eventually were the things
the,
that they really didn't
they
like.
hate.
I was too cool. I was really not jealous, and I was really never lying and always talking the truth. I didn't like it.
Yeah,
So, yeah, I don't know.
big mouth.
Mm-hmm.
I mean, capitalize on it, right?
Yeah, I don't know. I don't know how to capitalize it.
But I mean, you're writing songs. You're.
Yeah, on that sense, yes, but I capitalize it on a creative way. I do it. I capitalize on creative as much as possible.
But okay, okay, all right. Okay, what is so? If someone were to narrate your life, okay, who would it be? Who would you choose?
Snoop Dogg.
Snoop Dogg.
Yeah, can you imagine Snoop Dogg narrating something? Have you seen these videos with Snoop Dogg narrating documentaries with animals?
Oh yeah, I
Ah,
remember.
it's sensational. Imagine that. That's what I want. If somebody wants to narrate my life for any reason, like please Snoop Dogg do that.
Wow, how does he go? He's like, look at Dr. Peeps.
I don't
He's
know.
getting ready to go to
I
live.
I can I don't know. I don't know if I can impersonate Snoop Dogg, but I would love to.
Wow, that's funny. Okay, so Snoop Dogg.
Yeah, 100%.
Mm. There's a website that you can hire like these celebrities to like say something.
Yeah,
You know that website? You can hire them to like you can pay them an amount and then
yeah.
you can like give them like 1,000, 2,000
Mm.
or like whatever. And each celebrity has his own pricing and then you can make them say, "Oh, happy birthday."
Hey, now you can do it with AI. You don't need a celebrities actually.
Just AI now is here.
Just put an AI, put the face, and like say happy birthday to me. They do it.
Mm.
So
Then I'm just saying is that it's possible for him to narrate your life.
yeah, but I have to be working a whole life to make enough money to pay him to do
Yeah,
that.
Snoop Dogg. Snoop Dogg ain't cheap.
Hmm?
He's not cheap.
No, he has his price. I don't know if it's cheap or I cannot judge if it's cheap or not, but he has his price.
Yeah,
So and he does well. He does really well.
cool. Yeah. Okay. Let me see. What's the most chaotic thing you've ever done for fun?
Fun.
Chaos. Like you caused chaos.
Mm. We cannot say illegal things here. So let's talk about. Okay, once I went to visit one of my friends, one of my close friends,
Mm.
Ryan in California, in LA, and we get in his car, him, me, and his dog, and we went from California to Wisconsin, a road trip, like 10 days to go, 10 days to come back,
Mm.
and we were just for fun, just for the fuck of it, um, and we were just going side from side roads, not the
The highways,
not the highways. So we passed through forests,
small towns, and
small towns, met so many people, sketchy people, lost my passport, lost money, found my passport, managed to get the money back. Like it was crazy. It was crazy.
wow,
It was really fun.
10 days.
10 plus 10, it was 20 days back and forth.
Wow.
Yeah,
Okay,
I stayed a month there.
that's
And
crazy.
10 days we just chilled at his place. We needed to chill 10 days out of that road trip.
You needed like 2 months to recover from that, huh?
10 days was good. Yeah,
Okay.
yeah. It was okay.
Mm.
He has a good house, a nice house. His mom is amazing. We also had Halloween there. A lot of goodies. It was good. I
Nice.
enjoyed it. Yeah.
Yeah, California to Wisconsin. Wisconsin
Wisconsin, Wisconsin is like
is it Midwest or
mid-east.
Mid-East, right?
Mid-east.
Uh,
Mid-east, a little bit north. Like California is here. New York, let's say, is here. Here
yeah,
is
so almost across the.
almost, yeah. We passed through Nevada, Iowa. I don't know how it's called.
Yeah,
Nebraska,
that
uh,
must have been fun. Yeah.
Colorado. Yeah, we passed through everything. It
Yeah.
was super cool, super fun.
Would you do it again or?
Yeah, we're doing it again. But I mean, at that point, I don't know.
You were younger and had more
No,
energy.
I was young. It was like back in 2020.
Oh, okay.
Not that far away. It
It's
was
not
like
that
five
far
years
away.
ago. Yeah.
Okay.
I just had the time. Had the time. Now I don't know if I can commit 20 days at this point to do
Mm.
such a thing. Like I'll prefer this 20 days that I have to split it to go to see my family, have some time with my girlfriend. To do this kind of things.
Mm.
Travel a little bit.
Okay. Well, speaking about crazy, would you rather fight one horse-sized duck or 100 duck-sized horses?
Well, okay. Uh, that how big is it? Oh,
Horse-sized duck?
horse size like big horse. Like it's gonna be like
Yes.
gonna be big ass
Yes.
duck.
It's a big duck. Or 100 duck-sized
No,
horses.
that's I'm like it's 100 duck like 100 duck sized horses easy. Yeah, man. First thing you go to a narrow place and you don't let them all come at you all the time. Are they attacking you?
Well, yeah, it's just whatever the scenario is, they're attacking you or like they're following you.
They're trying to attack me
Yeah.
and harm me.
Mm.
Yeah, I'll take the horses.
Take the
If the
horses.
if the dog that day wants to attack me, will just eat me up. But the horses, you can go to a narrow place like the stairs there and let them come like three, four, bang, bang, bang. You can kill them. I can do that. I can kill 100 dog-sized horses.
All right.
100%. Bring them.
Go, go to Amsterdam and then maybe you will find a duck store.
If I what?
There's a duck store in Amsterdam.
Yeah, I've been there.
Yeah, you've been there?
Yeah.
Ah, that's funny, man. So 100 duck-sized horses.
100%. Anytime. Anytime.
Mm. There will be like this small-sized horse just running around.
Yeah, yeah. Come
Manageable, huh?
on. Easy.
Easy.
Easy. I won't even sweat.
Well, thank you, Pips.
Thanks a lot.
That was really fun. Thank you again for tuning in, and stay tuned for the future episodes. It was really interesting to talk to you about the research, the lifestyle, and especially about horses. Like at the end there was. Thank you guys.
Great. Thanks, guys.
That's good.
Good, man.